Good day friends, I'm Dr. A.S.K. Gupta and I'm going to talk to you about the ruptured ectopic pregnancy. This I can see that this is the and she has come to us with severe pain abdomen, that in the right lower part of the abdomen, and she had about 2 months of amenorrhea prior to this pain, and she has excruciating severe pain since yesterday night. And when we see the uterus, we find that this is the uterus and these are probably the ovary, but surrounding the uterus there is some complex fluid, and this complex fluid is nothing but clot of the blood around the uterus and the periuterine tissue, and we cannot actually differentiate the ovaries, but we can see that this is the uterus and the uterine cavity appears to be empty. You can see that the uterine cavity appears to be empty, and there is a complex fluid around the uterus which suggests that probably this patient had ectopic pregnancy which has now ruptured. And if I try to see the right upper abdomen, you can see that there is free fluid in the hepatorenal recess. This is the kidney and this is the liver, and between the two you can see that there is free fluid which suggests that this patient is having bleeding inside the peritoneum and there is a probe tenderness in the epigastrium. This is probably the gestation sac which is outside the uterus, but we cannot be sure. If I try to look for the heart activity in this sac-like structure, I find that there is no cardiac activity. So probably we are dealing with a case of ruptured ectopic in a young patient who has come to us with severe pain and free fluid in the hepatorenal abscess and the complex fluid in and around the uterus with this empty uterine cavity. All these features suggest that we are dealing with a case of ruptured ectopic. These patients, they should be investigated by way of urine pregnancy test and specifically by the beta HCG levels in the blood, and the beta HCG levels in the blood more than 2000. They suggest that this patient is having a pregnancy, and this pregnancy has probably ruptured. About 70% specificity and about 67% sensitivity is there for the complex fluid around the uterus, and most of the times the ectopic pregnancies, they occur in the tube, and about 5% patients the ectopic pregnancy can be in the ovary also. But by doing the examination we cannot really find out whether it was a ectopic pregnancy which was present in the tube or it was present in the ovary. By doing the laparoscopy on the laparotomy, we can find out where this pregnancy was, and such a surgery can be life-saving surgery for this patient. I hope you like this video. In case you like it, please do subscribe to our channel. Do not forget to press the like button and share the video among large number of your friends. Thank you very much.